Well, I came to you, Dr. Tracey Weisberg, right very early on in my treatment. But I think by the time I got to you, I had started working with a nutritionist.
That's right.
To go on a very clean eating program. Mm-hmm. And that, along with doing a regimen of daily exercise, I mean, I certainly think that it helped me through my chemotherapy.
Feeding your cells the best food and making sure that you have adequate hydration and movement, so that muscles stay toned and the chemicals that your brain makes, so that you can be happy and positive that you get from exercise, definitely help support people through treatment.
We put out on social media to ask us questions so that we could ask the experts, and I certainly have one here. This comes from Debbie Dana. She says, "Where are we now on this vaccination for triple negative? I understand there are trials for other breast cancers, but not triple negative. But I believe Mayo Clinic is working on it as well, right?"
Mayo Clinic is, and I think the NCI is as well. And it's not by any means widely available, but it is definitely closer than it was a couple years ago.
So we can see this one, because so many times you see these reports on TV, but it won't come our way for 5 or 10 years.
Well, it's going to have to go through a series of clinical trials, so it's not going to be universally available to women in the community. They'll need to be on an investigational study.
Gets them out to the public quicker. Mm-hmm. Interesting. Now, here's somebody who asked, Carrie asks, why does breast cancer spread to the brain or to the bones, even when a person is declared cancer-free? And I think the reason why I want to discuss this one is that there's this concept that if you just do a mastectomy, then you're done. When in fact, correct me if I'm wrong, that some of those cells, particularly in the early stages of formation, can actually go through your blood system and mm-hmm. go anywhere, to your brain, to your lungs, to many other organs, correct?
Correct. So I'm not sure that I ever had this discussion with you, because you had made a lot of decisions before you got to me. But when we take care of women with breast cancer, we worry about two major things. We worry about the local control, meaning making sure the tumor does not come back in the breast. And then we worry about the systemic control, meaning making sure that it doesn't come back in other organs. The local control is really important, but more important is the systemic control. And even if the tumor is small and the lymph nodes are negative, some percentage of those women will have, we think, seepage of tumor cells from the tumor, or maybe it's not the tumor cell, it might be what's called a stem cell that gets out from the tumor, circulates through blood or lymph, and then lies dormant, we think, somewhere in her body. It might be the bone marrow, it might be the spleen. And it hangs out there, or they hang out there, until a later date, and at which time they become reactivated and start growing what was in her breast in another organ. One of the things that our mothers didn't tell us is that when you go through menopause, things in the female private areas change. And if they change and intercourse is uncomfortable, or you're getting recurrent urinary tract infections, topical estrogen can alleviate those symptoms. And it is generally felt that women who have estrogen-driven tumors should avoid estrogen and estrogen-like substances, even like soy, although there really aren't good controlled studies. But if women are having symptoms of menopause that can be alleviated with some topical estrogen, fine, you use it. Now, the E-string happens to be a 90-day sustained release. I usually just have women use the minimal amount of Premarin cream that gives them the effect they need, but I encourage them to use non-estrogen things first to see if that takes care of their symptoms.
So old toughy me, I was fighting as much as I could to stay as healthy as I could. But toward the end, I do remember one day when you looked at my numbers and you said, if anyone else was sitting there, I'd probably send them out for a blood transfusion. But I'm going to give you your treatment. We're just going to bump it down a little bit.
I think I even also encouraged you to go get some
rest
and meat.
Yes.
To help build your iron up a little bit. And but many other women who've done that same protocol that you were on needed to have dose adjustments or holds far earlier than you ever did. That was really remarkable, and I attribute that to just your plan.
So it's the good nutrition and really being careful what you eat. It's the trying to, even though I know it's hard, but staying active, staying physical, and staying even connected with friends and going out and doing things. I think that's so important.
Absolutely.
It's easy to take on almost the psyche of the sick cancer patient and become a little reclusive.
I see it happening to many of my patients, and it's easier sometimes to just, retract into a shell. There's so many things that I think go on in a woman's head, that maybe she doesn't look the way she wants, she doesn't feel the way she wants. She's worried that she won't be able to sit through the whole movie without falling asleep or feeling sick, or she doesn't want to embarrass people if she needs to get up to go to the ladies' room in the middle of a meal, and so why bother? And so you pull back.
Boy, you really make it easy to understand, though, in what you just said, as to why a woman does that, because we're used to being the center of everything. We're the caretaker. We're the wife, the mom, the everything. We're the ones that are usually there taking care of everybody else.
You got it.
So it makes it all that much harder. How important is the psyche, the optimistic attitude, in making it through this treatment?
Attitude is almost everything. You have to take care of your body, but you have to take care of your mind too, and you have to be infused with positiveness. I tell my patients, there is no space for someone who wants to tell you about their friend who had the same thing you did and is gone, or had this happen to them, or this cancer treatment I read is horrible. Those people just can't be near you. They're negative power, negative energy, and of no use to you at that point in time. Maybe later, but you really can't surround yourself with that. You want positive energy around you, and more than anything else, you want to be normal. You want to be you and have your friends and do everything that you usually do, so you don't need some sappy Sarah there telling you all the horror shows she's heard.
To women out there right now, if you look right in that camera and you're talking to them, they see so much breast cancer around. What can they do to best protect themselves?
Knowledge is power. Making good decisions about what kind of screening is most appropriate for you. Being empowered, knowing about your family history if you can find it out, because there are things that you can add to, some gene testing to help you make better decisions about what kind of screening is best for you.
And for the women on Twitter that say, I'm not going for my mammogram because I don't want to know the answer because I don't want to lose my hair. Like, hello, do you know what the choice is? Like, have you thought about the other choice?
Right.
Like,
option B.
Do you realize what option B is?
And then, having a healthy lifestyle, which will hopefully protect you against developing cancer, or at least let you develop it later in life when you're an old person, but also protect your heart and your liver and your kidneys from all the other things that can happen to us from our environment, our food, our lifestyle. But most of all, not to be cancer phobic. don't
and
go
what do you
through
mean by
life
that?
being cancer phobic.
And explain that.
Well, I mean, I think maybe this doesn't ring true with you right now, but I don't think cancer is the worst thing in the world. And many people, many people are survivors. There are other medical conditions that scare me more than cancer. And to not do what you need to do for screening and detection and take the chance of getting cancer that's more advanced where there aren't as robust cures just is silly. I mean, there's some very not nice neurologic conditions and heart conditions and strokes where you just don't get a chance. You really don't get a chance to get better. And with some cancers you do, and you can impact that by doing the best that science has for the time to protect yourself.
Absolutely. All right. Thank you, doctor.